We've been watching the continuing toll of what's taking place with coronavirus. The number of cases in the United States continues to grow, and the death toll in America is now topping 2,500 people. Joining us right now to talk about what he sees happening and potentially some plans for when things might actually open up again is former FDA Commissioner Dr. Scott Gottlieb. He is also a CNBC contributor, and he serves on the boards of both Pfizer and Illumina. And yesterday, he put out a plan, along with a few other people, that explains what has to happen before we can get back to work, get back to school. Dr. Gottlieb, why don't you lay out the steps that you think are really vital before we can get back?
Well, we believe that in order to start lifting these population-based mitigation tactics, you need to see a sustained reduction in the number of new cases for at least 2 weeks, 2 weeks being one incubation cycle. You also need to have the capacity to screen the entire population, people who are presenting with symptoms of coronavirus. So that's a capacity that we peg at about 750,000 people a week. We're going to probably be there by the end of this week. So those are two of the key steps that you need to achieve. You also need the ability to do contact tracing and need the ability to support the local health systems if there is an outbreak again after you lift these restrictions. Those are some of the conditions that we think need to be met in order to start lifting these population-based mitigation approaches. I think they're probably going to be met towards the end of April into May. I think by the end of April, we're going to be peaking in the number of infections in this country, and probably into mid-May, we'll be able to start contemplating lifting some of these population-based mitigation tactics if you're following what we outlined in the plan that we released this weekend.
So the White House saying yesterday that they are extending this and expect it to continue at least till April 30th. You think it will take at least a couple of weeks beyond that?
Right. It's going to probably peak end of April, which is what we've been saying on this show for a while now, end of April, early May. And then you want to wait a couple of weeks to make sure that the reduction in cases that you're seeing is a sustained reduction before you start lifting some of these population-based mitigation approaches. The president talked about June getting back to business. I think that's probably about right. In May, we'll be coming down the epidemic curve. We'll be starting to slowly lift these approaches and substitute in other things. For example, you might tell a population that they don't need to shelter in place, but they need to wear masks if they go out. Into June, we'll be continuing to slowly take our foot off the brake. And I think in July and August, we'll be getting back to our lives. I think that, the summer also, the depth of the summer is also going to present a backstop. One of the concerns needs to be when we come back in September, that this doesn't come back again. There's likely to be some seasonality to that. And I think we can put in place the tools now. We have time to think about what that toolbox is to try to get it in place to make sure we don't have large outbreaks and certainly don't have another epidemic come the fall.
Part of it is not just getting tested and making sure people get the test to see if they have a test positive for coronavirus, but making sure you can get those results back in a timely manner, not waiting a week, not waiting 12 days in some cases and beyond to try and see what the situation is.
Right. They have a backlog of tests right now, and that's why they slowed down community-based testing and try to work off that backlog, which was largely around the hospitals. They didn't want to have tests delayed at the hospitals, so people were waiting in the hospital to get their test results back. So they worked off that backlog this week. I think you're going to see them roll out more community-based testing going into this coming week, especially with the approval of the Abbott system and Cepheid's Gene Expert. Those are community-based testing devices. What you really want, and I wrote about this in the Wall Street Journal over the weekend with Lauren Silvers, is a massive sentinel surveillance system where you can be testing people randomly in the background to detect where the virus might be spreading. And that's going to be an early tripwire, so you can know if the virus is spreading in a community. You can start implementing some measures there, start implementing case-based interventions. That's what we need. If we have that in place and hopefully have a therapeutic, and I think we will have a therapeutic by the end of the summer, that's a robust toolbox that can prevent another scenario like what we're experiencing right now.